Hi, my name's Amy. I'm a registered nurse for Dr. Duncan Taylor, who's a plastic and reconstructive surgeon in Perth, Western Australia. ALCL, or anaplastic large cell lymphoma, can affect anyone that has breast implants. Dr. Duncan Taylor will now discuss what ALCL is and what signs and symptoms you should look out for if you have breast implants.
My name is Duncan Taylor. I'm a plastic and reconstructive surgeon, and I have a subspecialty interest in breast cancer reconstruction and breast aesthetic surgery. ALCL is a term which stands for anaplastic large cell lymphoma. This is a type of cancer which can form around an implant or a capsule. In this setting and in relation to breast reconstruction or for cosmetic or aesthetic breast implants, it is called BIA, which is breast implant-associated ALCL. It is a form of transformation of the tissue into cancer cells, which is a consequence of the implant and the reaction of the body to that implant. It has gained a lot of press in recent times, and the incidence, though quite small, are variable depending upon whether the prosthesis or implant has been placed for a cosmetic fashion or in a reconstructive fashion, and relate to the nature and type of the implant used. The true pathology related to what causes this is still not been fully ascertained. There are different thoughts in relation to the etiology, which relate to either an inflammatory component or an infective component related to the tissue interface between the implant and your own body. If you've had an implant placed, then in relation to ALCL, what you should look out for yourself is change to the shape of the breast. The most common clinical finding related to ALCL is a relatively sudden increase in the breast size, which relates to an increase in fluid around the implant. So an acute swelling of the breast with no trauma or other preceding problems in the first few years, or even up to the first decade or two, should be investigated as a matter of urgency. Typically the investigations, if there is concern for the breast changing shape or swelling in size or becoming more painful, would involve imaging, and the imaging modality would be chosen by the specialist which you went to see. This may initially be ultrasound or even maybe CT or MRI. But in terms of the definitive diagnosis, a piece of fluid or tissue needs to be taken from around the implant or around the capsule.
We hope these videos have been a valuable resource to you. Please visit Dr. Duncan Taylor's website for more information.